Nowadays, everybody is very concerned about the coronavirus. It has been declared a global emergency by WHO. Now, what is a coronavirus? Coronavirus is a family of viruses which cause multiple illnesses, especially in mammals and birds. It can also infect human beings as well. The word corona is derived from a Latin word, corona, that means crown. It looks like a spike as it is wearing a crown. Coronaviruses mainly infect animals, but it can also infect human beings as well. And sometimes their transmission from human to human. Coronaviruses has been there for a very long time in the animal kingdom. But three major outbreaks which occurred in recent history, which well known, are SARS, which is severe acute respiratory syndrome, which occurred in 2003. And then second major was MERS, which originated from Saudi Arabia in 2012, and more recently from China, Wuhan coronavirus, which has been labeled as novel coronavirus. Very often, they spread very rapidly. So the coronaviruses are basically viruses which can cause diseases from very mild symptoms like common cold, which everybody gets, to very severe disease leading to respiratory failure, kidney failures, and ultimately high mortality. A recent novel coronavirus was spread through a meat market in Wuhan city in China. Exact source is not known, but it's assumed it was the live animals which were sold in the market, because initial patients who were affected were the ones who were in contact with those animals, and then from human to human spread occurs later. Currently, the most suspected source is either bats or the snake, and the spread is by droplet infection. That means by coughing and sneezing, human to human spread is through the droplet infection. As I mentioned earlier, coronaviruses can cause common cold. So the usual symptoms of common cold, such as cough and fever, are the initial symptoms. But as the disease progresses, then you can get other symptoms such as shortness of breath as well, and pneumonia, in other words. And patient can go into severe respiratory distress and respiratory failure. Remember, coronaviruses generally affect upper airways. That means it just causes nasal symptoms and throat symptoms. And occasionally, it leads to the lower respiratory tract, causing pneumonia, bronchitis, or difficulty of breathing. Some of the patients recently diagnosed in novel coronaviruses, they developed kidney failure as well, and they ended up on the ventilation due to respiratory failure. I think it's very important to understand how it spreads. Then we can protect ourselves from the spread. This is droplet infection. That means when the patient is coughing or sneezing, he is spreading out these droplets which contain viruses. Now, if those droplets are inhaled or get in contact with any individuals, so he is susceptible to these viruses. So that means that if we have any symptoms of common cold, if we are coughing or sneezing, we should cover our nose and mouth, not with the hands, but with the tissue or with flexing our elbows with the elbow. Because if you cover with your hands, then you are transmitting your viruses to your hands, and if you shake hands with somebody, then you will transmit that viruses to that particular individual. So to protect ourselves, we should avoid from people who have common cold. At least we should stay away at least 6 feet from the infected person. We should not shake hands with the person who has symptoms of cold, and we should ask him to cover his nose and mouth when one is coughing. The second thing is hand washing. The most important aspect is the hand washing. Every time we are in touch with a person who has common cold, or lately due to novel coronavirus, if you are handling any meat or meat products, then wash your hands immediately afterwards. We should not be touching our nose and mouth with dirty hands, because that's how it is transmitted in the virus. Can we protect any vaccination? Currently, there are no vaccinations available. So at this stage, the important thing is just to avoid to be in contact with the person who is infected. Now, what should we do if we have symptoms? For example, somebody has a cold. Does he have a coronavirus? What should he do? Anybody who has the symptoms of flu should stay at home. They should not go to work because they can infect the others as well. They stay at home. The general time is 1 to 2 weeks. So that period should be spent at home in isolation. If we do develop the symptoms of common cold, and if we are, so far there's no case reported in Pakistan, so it's very less likely that we are having a coronavirus. However, if we have symptoms of common cold and we have a difficulty about breathing, then one must see a doctor, because difficulty of breathing is not a symptom of a common cold. And individuals who are at high risk are the ones, elderly people. People have chronic diseases like chronic heart problems, the lung problems, the kidney problems, severe diabetes, etc. They must seek advice immediately. If they develop shortness of breath with cough and fever, they should seek the medical advice. And until then, they should not be in the public places. They should avoid going to the malls, etc. As of today, the only treatment available is supportive care, that the bed rest, lot of fluids. There is no specific treatment for viruses currently available. There has been a lot of progress and there's work going on in developing a vaccination, but I think the vaccination part is still way off. It may take quite some time before they develop a vaccination. So currently it's a supportive care. However, if a patient is sick enough to be admitted in the hospital, so he may need the oxygen therapy, he may need the fluids, he may need antivirals, and sometimes the antibiotics, because they can also develop bacterial pneumonia. But person who has very mild symptoms of flu, they does not need any specific treatment, and there is no specific treatment available either. Just take a rest and a lot of fluids. Thank you very much.